Hi everybody, this is Joey, and today we're going to talk about the 5 reasons that CUBEX is an absolute no-brainer for the veterinary staff. Okay, first reason, we're going to automate those drug logs. So you know what I'm talking about. Most practices have like a binder or a few binders, hopefully, because you're supposed to have separate binders for each scheduled narcotic. But you've got a few binders or spiral notebooks. You've got those handwritten drug logs that take forever to fill in, that you probably haven't gone through and resolved discrepancies on for a while. And they're just really laborious. It's, pen and paper. It takes a long time, not super accurate. So CUBEX makes those all go away in favor of an automated system that's backed up to the cloud. It's much neater. You can actually read it. It's readily retrievable. So if the DEA or hopefully the DEA is not coming down, but if the DEA or the state board pops in for an inspection, you can pull those logs right up out of the cloud or off of your system and print them out if they'd like to see a hard copy. So automated logs, that's probably the biggest reason that people bring CUBEX in at first. Because it's just such a hassle to do those controlled substance logs manually. Okay, number 2, patient safety. Now this is a little bit of a surprising one, but if you think about it, how many times have you reached for and grabbed the wrong strength of medication? Or if this has ever happened to you where you can't really remember, have I already given this patient the dose of medication? And maybe you did again. And for a lot of medications, that's okay, but there are some meds where giving 2 doses actually can be really hazardous. And a lot of those are controlled substances, obviously. And that's where CUBEX usually starts the journey with a customer. So with CUBEX, you're going to have absolute proof of if you've actually administered that dose, and CUBEX is going to prevent you from grabbing the wrong strength because it's only going to give you access to the right strength of medication. See, in CUBEX, every med gets its own little compartment, and so when the drawer slides out and the lid pops open, you know that's the medication that you're supposed to be giving. Number 3, automatic ordering. Think about the way that you order products right now. It basically hasn't changed since like the 1960s. You go through the pharmacy or your supply room and you probably shake pill bottles to figure out how much is left in each one, and then you write down what you need on like a clipboard or something. I mean, it's 2020, and look, we all know 2020 has been that year, right? But the good news about 2020 is we have the technology to make this so much easier now, and that technology is CUBEX, right? So CUBEX knows exactly how much you have in stock of every SKU at any time. And as soon as that supply level reaches a minimum threshold, then CUBEX is going to automatically populate your electronic shopping cart for your distributor of choice with a replenishment order. You're going to see all of those items that you're low on already in your shopping cart. That way, you can take all that time that you're spending right now on inventory and ordering, and you can reallocate that to what you do best, taking care of patients. Okay, number 4, and this is a new one, state-based prescription reporting. Now, there are 23 states and counting that require veterinarians to report prescriptions and dispensing of controlled substances through what's called a PMP or prescription management program. Now, sometimes it's called PDMP, but it's the same idea. Now, these programs have been around for decades, but veterinarians have traditionally been exempt. Veterinary practices are much smaller than human hospitals, and they don't have the clerical staff or the technology to make this kind of reporting simple. Obviously, pharmacies do this every day. So, Rite Aid, Walgreens, they all report these prescriptions on a daily basis to a centralized database to make sure that somebody is not trying to fill the same script at multiple pharmacies, because that can be a sign of either an addiction problem or some other sort of illegal diversion. But veterinary practices recently have started to lose that exemption in one state after another. And again, we're up to 23 now because veterinary practices have kind of been identified as a soft spot for drug diversion. Veterinary practices carry a lot of dangerous drugs, a lot of controlled substances, and the general public is waking up to that, including, unfortunately, people that want to abuse those drugs. So the PMP program has become another administrative burden for veterinarians, and fortunately, CUBEX PMP gives you a way to manage that. So CUBEX PMP takes these manual reports that ordinarily have to be, created in Excel by the practice, or some practice management systems have like a starter report that you can use, but they've got to be created by the practice and then electronically submitted via a website like an FTP server to the state, or you could use a fax machine, and most veterinary practices have a fax machine, so it's not the worst way in the world to submit it, but they've got to, it's a very manual process. You've got to fill this report out, go through a log and see, okay, who got controlled substances. With CUBEX PMP, everything just comes right out of the automated system. It's right there on a computer screen. You might have to go through and add like one or two fields of data, like the driver's license number. I can't say that right. Like the driver's license number of the pet owner, or sometimes the pet owner's birthday. But all in all, it's like 90% automated, and then you just hit submit. You don't have to go and upload it to a website or anything like that. It's just super easy. So PMP reporting through CUBEX PMP is much, much simpler than the manual method, and it allows your practice to stay in compliance. Okay, number 5, more profit for your business. Now this benefits everybody at the practice, whether you're the newest employee or you're the senior partner, right? And that's because when the practice is more profitable, then everybody wins, right? So think about what we talked about earlier about how easy it is to make a medication mistake. And now think about the environment that we've all been operating in for the last 9 months with new COVID protocols and increase in curbside check-in and other personal protective protocols that just take time. And think about how, again, not only is it easy to maybe grab the wrong medication, but it's also very easy to forget to charge for that medication. Mischarges are the number one driver of the ROI that we see when we look at practices on a year-over-year basis. When we put CUBEX in, the year before, what did the pharmacy gross, and then what did the pharmacy gross with CUBEX? We see huge growth. In fact, you can look at my other video on ROIs to go through some of those case studies in depth. But mischarges are the biggest driver of that, and it's really simple, guys. We're all human. Going all the way through the process that's required to go from a prescription all the way to a successful client charge, it's complicated. There's a lot of steps there, and veterinary practice staff are busy, especially now. Fortunately for us, the animal health business has actually grown quite a bit during the pandemic, because so many people are welcoming pets into their homes. But that's also creating a lot of extra work. And sometimes what kind of gets thrown out of the lifeboat is, remembering to put the client charge into the practice management system. So CUBEX automates all that. As soon as the drawer comes open and that little door pops up on a QB, that medication is being logged as dispensed by the CUBEX system, and the charge is going to be processed automatically as long as you've got CUBEX Connect integration. So you do need to have integration for that, the CUBEX Connect product, and that's something that you can get CUBEX as an unplugged system, and there's a lot of value, but mischarges is just not part of that value if you have unplugged. So again, as long as you've got CUBEX Connect and integration with your system, and that billing is going to happen automatically, you're going to see a huge return. On average, it's $25,000 per doctor per year. And another way to think of that is it's going to be between 2 and 6 times whatever the CUBEX subscription costs. So if you're spending $1,000 on a CUBEX subscription, we expect that you're going to get between $2,000 and $6,000 back in mischarges and other forms of improved profitability. What are some of those other forms of improved profitability? Well, you're also going to reduce shrinkage, which is a euphemism for theft. When everything is just sitting on a shelf, it's easy for people to grab stuff and walk away. You're also going to reduce overbuying and expiration issues, because CUBEX is going to help you take the container that's shortest dated first, right? So that's another benefit of the CUBEX system. And guys, this improved profitability benefits everybody, because when the practice is more profitable, people can get more hours, people can get more raises, and the practice can hire more staff so that the staff that is there isn't so overworked, right? So it's really a win for everyone when the practice is just earning what they should be earning and taking in what they should be, because all the medications that are actually leaving the practice are being charged for, as opposed to, the status quo where anywhere between 15 and 20% of medications go uncharged. And I know that sounds like a bananas number. Like, there's no way our practice is giving away 15% of our medications. In this particular area, everybody thinks they're above average. Nobody thinks that they have a problem. But then lo and behold, we look at the year over year, and it's like, every time, we see this huge jump. And that's why that jump happens. Sometimes it takes practices a while to resolve that cognitive dissonance. Like, I guess we were missing a lot of those charges. And I guess, that this really is incredible now that we're not. But that's something that you're going to see with CUBEX if you bring it into your practice, definitely. Well, I hope you guys enjoyed this video. We're going to be doing more videos in the weeks to come. And if you like this video, please like it and then subscribe to this channel, and also hit that bell for notifications. That way you'll get a notification whenever we post a new video. Thanks, guys.